This is mine. Take this one. I'm going back with my own. Thank you, Ebony Waves. Good morning, class. Well, all welcome to yet another antenatal class today. I know we missed one of 2 weeks ago, but we're back refreshing and ready to continue again in our program of empowering you, in our program of making you advocates, in our program of ensuring that we have healthy baby, healthy mother, and a happy family. But most importantly, having advocates that will go and let us know what are the trending things now, what are the new changes that are going on. We'll come to that when we are ready to talk later. But it's customary to start any meeting in Nigeria and everywhere with prayer. So we're going to start the second stanza of our national anthem. It's actually a prayer. So we're going to start with that, and then we'll take the DIFF anthem, and then Ebony will be talking to us about unconditional love. There's unconditional love between husband and wife. So today we shall hear that. Two-Face Idibia. Is Two-Face Idibia qualified to talk about unconditional love? Okay, we'll hear later. Let's please be on our feet as we take the second stanza of our national anthem in honor to our nation. Thereafter, we shall be led with the DIFF anthem. You're all welcome. Thank you.
O God of vision, direct our noble cause, guide our leaders right, help our youth the truth to know. In love and honesty to grow and live in just and true. Great love behind mountain to build a nation where peace and justice shall together bringing hope for the joy of mankind, committed to excellence, home and abroad, motivated we are, together we stand. God bless this legacy. God bless this legacy. Decentralized sectors yet integrated, effective and harmonious workforce we are. Erase mortality, encourage research. God's grace is what we enjoy. More grace to this legacy. United, opposing the dream we all share. We pledge to our rights to this clarion call. Our passion, our service to God.
pick a song now. Unconditional Love by Two-Face Idibia. Two-Face Idibia. I'm sure many of us here know him.
They don't know you, but they're constantly judging. They don't know the shape of your head, but they're constantly shaving it. They don't have a clue, they don't know your burden. See, all I can say, you have a place in heaven. They don't understand the things that you go through. And 9 months is not a joke, I tell you. Oh, my mama, sweet mama, I swear I will love you to the end. My mama, sweet mama, no one compares to you, I swear. I cherish you, God bless you, for all the selfless things you do. Mama, thank you for raising me with unconditional love. With unconditional love, with unconditional love, with unconditional love, unconditional love, unconditional love. Unconditional love. I want to thank you, Papa, too, for staying with Mama all through the years. All through the years. You taught me how to be a woman with love and steadiness. You taught me how to treat people with respect and fairness. I don't know how just you did it. I guess Mama kept you grounded. Oh, Mama, you are more than an angel. Yeah. Oh, my mama, sweet mama, I swear I will love you to the end. My mama, sweet mama, no one compares to you, I swear. I cherish you, God bless you, for all the selfless things you do. Mama, thank you for raising me with unconditional love, with unconditional love, with unconditional love, with unconditional love.
Thank you, Mama.
Unconditional love. Unconditional love.
Thank you, Mama.
Unconditional love.
Mama, you're the air that I breathe in. You give me life, give me hope. Took the wars, you're the reason I'm standing so strong on my ground. You taught me to be bold, Mama. You are amazing. This song is written to appreciate your love and kindness. Nothing compared to you, mama, you an angel sent from heaven. What a love from above, you're thankful.
Oh, my mama, sweet mama, I swear I will love you to the end. My mama, sweet mama, no one compares to you, I swear. I cherish you, God bless you, for all the selfless things you do. Mama, thank you for raising me with unconditional love. With unconditional love. With unconditional love. With unconditional love. Hey, oh my mama, sweet mama, I swear I will love you to the end. My mama, sweet mama, no one compares to you, I swear. I cherish you, God bless you, for all the selfless things you do. Mama, thank you for raising me with unconditional love. With unconditional love. With unconditional love. Unconditional love. Unconditional love. Unconditional love.
Thank you, everybody. Let's put our hands together for them. These people sure have talent. And there are various people working in various departments in this hospital. So they are not just musicians, but they have it as a secondary part of their vocation. Unconditional love. I lost my mother almost 20 years ago. By August, it will be 20 years ago. But I will never forget my mother. Unconditional love. I'm sure all of you here have one good thing or other to say about your mother. Thank God for our mamas. Thank God for them. Thank God for how they have nurtured us and brought us to where we are today by the grace of God. The Chief Medical Director, sir, the Head of Department of Ops and Gynae, Dr. Barrow, our Chief Resident, our dear beautiful nurses, led by the head nurse and others that are here, our wonderful students and their spouses and their other relations. We are all welcome for yet another important class today. A woman who carry pregnancy, go through all the challenges that has to go with it. Some will say, doctor, you didn't prepare me for this one. It's another thing, I can't sleep again. Baby is crying, baby has to be fed, baby has to do this one. Most importantly, they say, we don't even know how to handle babies. We don't even know how to position ourselves to breastfeed babies. We don't know how to even bath our babies. The last 1 week or so, that's why part of the reason why we didn't have antenatal class on the 6th was because it was International Week for the nurses. And on the 6th, our nurses embarked on a trekking exercise to keep body fit. We're celebrating a lady called Florence Nightingale. It was her birthday. Her birthday was on the 12th of May. She brought transformation and brought innovation into modern nursing care. And based on what she has done, the research work she has done, the bridge of data, scientific evidence of how to nurse and all that, brought innovation. And so Nightingale is being celebrated for over 50 years now all over the world as International Day of the Nurses. So it's a week-long packed event. And when you're talking about seeing beautiful nurses that have brain, they have beauty, they have diligence, they have hard work, nurses are the custodian of the hospital. Without nurses, there will be no hospital. our nurses packaged a beautiful program for us throughout last week, and we celebrated them. In continuation of that celebration, the nurses will be doing our presentation today. But most importantly, we're trying to empower you, educate you on how to breastfeed your baby. We're having a lot of challenges with positioning, cracked nipples, infection, mastitis, and all that thing. Most importantly, baby is not latching well, baby is frustrated, mother is frustrated. Before you realize it, depression will start. So today, our nurses are going to be doing a wonderful job on that aspect. During the week, when we did our gala night, they brought out men to come and see, can men change pampers? Can men wear pampers too? You'll be surprised. I will tell you what happened that day. Maybe it will teach us today how to wear pampers. During our time, they are using one cloth to just tie around our waist. They are using, eventually they came to napkins. Some of us maybe were lucky to have used napkin that time, with all the challenges that the safety pin has. For boys, if you're not careful, you go and catch something. That boy baby bleed. And the baby will just be shouting. If you don't know that you've caught something in that baby can even bleed to death. But thank God for the period of pampers today. Today, we will know how to wear pampers by the grace of God. And we have two beautiful nurses that will be doing. To kickstart this presentation, we have our own beautiful young Linda Okonkwo, who will be talking to us. Let's put our hands together for her. Just judge your patience as she goes around with her lectures. Put your observations. Immediately after her, the head of pediatric nursing will come and speak to us. Then maybe at the end, the head nurse will just talk briefly before we relax a little, take our questions and answers. CMD is ready here to buffer all that has been said and done. And then we're also here to support. The head of the Department of Pediatrics will be joining us. He's aware, he and his deputy and others. Chief President is also already here. So thereafter, Ngozi Herekin will come up and talk to us on how to bath baby. So it's a double-barrel presentation today. You're all welcome. Let's put our hands together for these presenters. Yes.
Good morning, the CMD, Director of Clinical Services, Head of the various departments, distinguished ladies and gentlemen. You are welcome to this antenatal class. My name is Okonkwo Linda from Pediatric Department. I'll be taking you on exclusive breastfeeding, importance of breastfeeding, and breastfeeding positions. Objectives. At the end of this lecture, the main objective of this lecture is to enlighten mothers on the benefit of exclusive breastfeeding, to counsel mothers on the negative notions about exclusively breastfed babies, to teach mothers the various breastfeeding positions safe for them and their babies. Now we've been talking about breastfeeding. Breastfeeding is one of the most effective ways to ensure child health and survival. However, contrary to WHO recommendation, fewer than half of infants under the age of 6 months are exclusively breastfed. Breast milk. When we talk about exclusive breastfeeding, then the breast milk itself is the ideal food for infants because it is safe, it's clean, it contains antibodies which help protect against many common childhood illnesses. It also provides all the energy and nutrients that the infant needs for the first months of life. And this breast milk is not just for the first 6 months. As you continue to breastfeed, it continues to provide the nutritional needs for the child during the second half of the first year and up to one third during the third year. Some research has shown that Children that are breastfed, exclusively breastfed, they perform better on intelligent tests, that their intelligent quotient is higher than those that are being given formula. And then they have a lower risk of overweight and obesity. Because this, as I go on, you will understand, I will list the importance of the breastfeeding to the babies. The breast milk, it lines the gut, the digestive gut, that helps and minimizes the fat absorption, which prevents excessive weight gain for the baby. Now, what is exclusive breastfeeding? Exclusive breastfeeding means feeding your baby only breast milk, not any other food or liquids, including infant formula or water, except for medications or vitamins and mineral supplements, according to WHO and UNICEF definition. Then the American Academy of Pediatrics recommends exclusive breastfeeding for 6 months and continuing even after solid food are being introduced until at least 1 year of age, or until both the mother and the child decide to call it a quit. Why WHO says that, recommend that you breastfeed your child till 2 years old, because as you continue breastfeeding, that's how the benefit continues. And they recommend that this exclusive breastfeeding, you start breastfeeding your child as early as 1 hour after birth, because of the biggest benefit. Then you will see why this recommendation came. Now, for mothers, if you have been considering not to breastfeed your baby, you are probably overwhelmed with information that you get confused. You don't know which one to follow, or whether to do exclusive breastfeeding or to combine it with formula. Exclusive breastfeeding is a personal decision only you can make, but the benefits are seemingly endless. So before you decide, or if you just need reassurance that breast milk is the right choice for you, let's go through all the benefits to both you and the baby. So before we go to the benefit of breast milk to the baby, I want to tell us the composition of breast milk, because some mothers, they will tell you that you are asking them to breastfeed the child and not give water. They will give you an example, like if you're thirsty and you take a bottle of Coke, does it quench the thirst? Now let me tell you that breast milk contains 87% of water, 1% of protein, 4% of liquid, that is fat and oil, and 7% of carbohydrates, including 1 to 2.4% of oligosaccharides. It also contains some minerals like calcium, phosphorus, magnesium, potassium, sodium, and many vitamins. Then, benefit of breastfeeding to baby. 1, breast milk provides ideal nutrition for babies. When you come to almost all the healthcare practitioners, they recommend exclusive breastfeeding for your child, at least for the first 6 months or much longer. Reason, because it contains everything your baby needs for the first 6 months of life in all right proportion. During the first days after birth, your breast produces a thick and yellowish fluid called colostrum, which is high in protein, low in sugar, and has a lot of benefits. So that is why it is called a wonder food that can never be replaced by formula. But the only thing that might be, not that it is not contained in breast milk, is vitamin D. It is contained in low quantity. So it is recommended as you're pregnant or even as you're breastfeeding, you eat food that are rich in vitamins like egg, yogurt, milk, liver. Take fruit that are rich in vitamin to increase your vitamin intake, because it is being passed to the baby through breast milk. You can as well, baby can as well be prescribed vitamin D drops. Number 2, it contains important antibodies. Breast milk has a lot of antibody that helps your baby fight off viruses, bacteria, which is critical in those tender early months. And this applies to the mainly colostrum. That is why we recommend that you start breastfeeding after birth as soon as possible. In some cultures, they will tell you that colostrum is bad milk, the first milk that comes out, that you should express it out. But that's not the truth. Colostrum provides high amount of immunoglobulin that provides immunity for your baby, as well as several other antibodies. Like, how did your baby get this immunity? If you're exposed to viruses or bacteria, your body builds antibody, and this antibody now is being passed on to your baby when you breastfeed, which provides immunity for the baby. So the kind of immunity, the immunoglobulin that is responsible for providing this immunity that is in breast milk, high content in breast milk, is in colostrum, immunoglobulin A. It protects your baby, it protects the layers of the nose, like the mucous membrane, the layers of the nose, the throat, and the digestive system, because those are the areas that, because of the nature of the area, it builds up infection easily. Why, in this case, formula doesn't provide such antibody and protection for your babies. Numerous studies show that babies who are not breastfed are more vulnerable to health issues like pneumonia, diarrhea, and infection. Some mothers that, like some of the Gravida 2, Para 2, some of them testify to it that their babies that they did exclusive breastfeeding, they hardly fall sick. And even when they are exposed, because their immunity is very strong, it's stronger than those babies that are not exclusively breastfed. 3, breastfeeding may reduce disease risk. This means that infants that receive only milk, it may reduce the risk of your baby falling sick all the time, like when your baby is being exposed. And the reason for this is, when you are breastfeeding your baby, giving your baby only breast milk, it reduces the risk of disease, because if you are using formula, washing, how do you take care of your bottles? The milk is a great medium for building microorganisms. You might not be the only one. You might have a help, and the help will tell you, yes, I've washed the feeding bottles, I've sterilized it. You don't know how clean and how neat it was. But if it's breast milk, it is always in the right proportion. You are the only one, you know you are the only one handling your baby. So if anything comes in, you can easily detect where it's coming from. So breast milk protects babies from middle ear infection, respiratory tract infection, cold and flu infection, gut infection, intestinal tissue damage. This is particularly for preterm babies, because breast milk is linked with reduction in the incidence of necrotizing enterocolitis, that is NEC. For preterm babies, they always have this condition. So that is why we always recommend breast milk. And if after giving birth and your breast doesn't flow from the second day of birth, we recommend, we have breast milk bank. You can get from our breast milk bank to start giving your baby breast milk instead of formula. Then allergic diseases. breast milk prevents your babies from getting allergic diseases. Number 4, breast milk promotes babies' healthy weight. Like I've said before, it helps to regulate the weight of your baby, makes your baby not to be obese. It promotes healthy weight gain and helps prevent childhood obesity. This may be due to the development of different gut bacteria. Breastfed babies have higher of beneficial gut bacteria, which may affect fat storage. Then, breastfed babies also, they self-regulate their milk intake. They are better at eating only until they have satisfied their hunger, which also helps them to develop healthy eating patterns. Then, what are the benefits of breastfeeding to mothers? It helps the uterus to contract. You know, as you're all pregnant, the uterus is a pear-shaped organ that is located in the pelvic region. It's very small. But when you get pregnant, it begins to increase and enlarge. Comes out of the pelvic organ. It increases. So, when you give birth and you are exclusively breastfeeding your baby, these uterus that have enlarged as you're breastfeeding, it contracts. So breastfeeding helps it to contract and go back to its pre-pregnant stage, and it is called uterine involution. Also, as you're breastfeeding, and a hormone is being released called oxytocin, and this oxytocin, as it helps to contract the uterus to take it back to the pre-pregnant stage, it also prevents bleeding. Mothers who breastfeed have a lower risk of depression. Mothers who breastfeed their babies have a lower risk of postpartum depression. There's what we call postpartum depression. It's a type of depression that can develop shortly after childbirth. Women who breastfeed seem less likely to develop postpartum depression compared to mothers who wean early or do not breastfeed at all. However, those who experience postpartum depression early after delivery are more likely to have trouble feeding and use shorter duration. This postpartum depression, how does breastfeeding reduce it? You know, after giving birth, your breast is attached to your body. You don't have to think, oh, how do I get money to buy formula for your baby, making the right choice for your baby. Some babies, they select milk. So when you might buy none, and when they take it, it's not good for their system. That one is there, you keep it. You buy another one until you are able to get the right choice for your baby. All these things increases the risk of stress, thinking, and also, if you are using formula after giving birth, you're waking up in the midnight to sterilize after breastfeeding, after feeding your baby with formula, you're washing bottles, you're sterilizing it. Instead of sleeping, you're sterilizing it, you're boiling water, you want to go out, you start thinking of how you pack your bag, boil water, put milk, did I put all this? But if you're exclusively breastfeeding your babies, you don't have trouble, you have no problem planning for all these things. All you need to do is just carry your handbag, put your baby diaper, put the clothes, and then you and your baby, off you go. Anywhere you want to go till the end of the world, you're there with your baby and your food. Then breastfeeding reduces your risk of diseases. Breastfeeding seems to provide you with long-term protection against cancer and several diseases. The total time a woman spends breastfeeding is linked with reduced risk for breast and ovarian cancer. Breastfeeding may prevent menstruation. Some women during breastfeeding, they don't menstruate, and it's a natural form of family planning. But nevertheless, that you're not menstruating does not mean that you are not ovulating. But in rare cases, that is in rare cases. So it helps you in child spacing. Imagine you're breastfeeding your child up to 2 years. That means from that time you gave birth till 2 years, you're not going to take in. And when you decide to call it quits, you and your baby, then you can take in. Your baby has grown enough for you to have another baby. By that time, your body has readjusted well enough. But if you are not exclusively breastfeeding, you can take in as early as 3-4 months after giving birth. And that also contributes to postpartum depression, the stress of pregnancy, taking care of your newborn. So when you exclusively breastfeed, it helps to prevent menstrual cycle, and is a form of natural family planning. It saves time and money. To top the list, breastfeeding is mostly free. Like I said, you don't need to start thinking about the money. Milk is about to finish. Oh, I don't have money to get another milk. No. All you need to do is, all those things you are thinking about, the money you are going to use to buy milk, use it and eat good food, and your baby will get all the nutrients required from you. Because it's mostly free, barring expenses from any lactation, consulting and breast pump. You start thinking of how you buy sterilizer, so many things. There are so many troubles with formula feeding. But if you're breastfeeding, it's just you and your baby. By choosing to breastfeed, you won't have to spend money on formula. You will not calculate how much your baby needs to drink daily, spend time cleaning and sterilizing bottles, mix and warm up bottles in the middle of the night or day. Or you don't have to start figuring out ways to warm up bottles while on the go. Imagine you're traveling and you're with milk, and you carried your hot water. The hot water might even finish on the way, and the baby will cry tears out of it. And people will be looking at you like a mother that is not compassionate. Attend to this baby now. You will just be sweating. Sorry, you're panting. But if you're exclusively breastfeeding your baby, you're there with the food. Once baby cries, all you need to do is to put baby to breast. You don't have to start thinking of how to warm up bottles. You finish feeding, how do you wash the bottle if you're traveling a long distance? How do you wash the bottle? Will you start carrying sterilizer along the way? But if it's exclusive breastfeeding, you don't need to worry about all these things. Breast milk is always at the right temperature and ready to drink. Sometimes the way baby cries, we panic that we tend to forget to check the temperature of the milk. So you might make it and it will be too hot, and you give it to the baby and you burn the tongue. But if it's breast milk, you don't need to worry about all these things. It's always at the right temperature. All you need to do is just put your baby to breast. Note, the benefits of breastfeeding are so numerous. These are just a few I mentioned, that most health agencies recommend it for everyone for as long as possible, barring medical problems, except for the medical problems that prevent you from breastfeeding. Apart from that, I don't think that at the end of this lecture you have any reason to say you will not exclusively breastfeed your baby, because you will benefit at the end. Breast milk contains antibodies and other elements that protect your baby from illness and chronic diseases. It is the best start you can give if you are able. Then we are going to talk about breastfeeding positions. Okay. So we are going to talk about breastfeeding positions. The first one is cradle hold. This cradle hold, this is the most common position that all of us are used to. How is it done? Especially for first-time mothers. You make sure that your baby's hand is under the armpit. This is the picture of the cradle hold. Make sure that your baby's hand is under the armpit. Then the whole nipple is inside the baby's mouth. Then you have more of the areola down than up. Then make sure that the baby's lip is turned out. Before we finish, you will see the how to know if your baby is latching well or not. Then you hold your baby. So as you're breastfeeding your baby, it also creates bonds between mother and child, because as you're breastfeeding your baby, you're looking at your baby is looking at you, and that is why babies always identify mothers while they're looking at the face, and also because of the smell of the breast milk, so they identify their mothers more easily than any other person. So this is cradle hold. As you're breastfeeding your baby, you're looking at your baby. Then you sit comfortably, you sit comfortably like Taylor's position to prevent backache at the end of breastfeeding. So you have to get a chair that you sit comfortably. You can get a chair that has arms to rest your back and your arms. It's just like form of cuddling. You're cuddling your baby and you're also breastfeeding. You're relaxed. Then the second one, cross cradle, is just the reverse form of cradle position. This is mostly for primaries, finding it difficult to put babies to breast until they learn, and it's for small babies. How is it done? You can put it in any position. Your baby, you are supporting your baby's head with your hand, and then using the left hand to put the baby to breast. That is cross cradle. Football hold or rugby hold. This, you can buy, they have breastfeeding pillows. This is mostly for women that undergo cesarean section, because you cannot place your baby on the stomach. So when you use this breastfeeding pillow, it helps to elevate your baby very well. Then you are holding your baby. You see the way it is. The baby's leg, the two legs are under the right armpit. The left hand is under your armpit. It helps you to have a good hold of your baby, and then the baby latches well. So the baby's tummy is touching your chest. This is football hold. Side lying. Though we don't usually recommend this, but if you're going to do the side lying, that is lying by the side, you elevate your side with a pillow, and make sure you're not feeling sleepy, so you don't suffocate your baby with your breast. Make sure you're not feeling sleepy. As the baby is lying down, you are supporting the breast with your hand as the baby latches. Then, signs of good latch. How do you know that your baby is latching well? How do you know that your baby is well attached to the breast? A comfortable experience with no pain. You don't experience pain. If baby is not well attached to the breast, you feel pain. That's when baby is suckling on the nipple. And that's one of the causes of sore nipples and cracked nipples. Then the more areola is visible above the baby's mouth, above the areola, the black pigmented area, more of it is above your baby's mouth. If more of it is below, that means the baby only grabbed the nipple. So as you're putting your baby to breast, you watch. Make sure that the pigmented area, more of it is up. Your baby's mouth is wide open. Their lower lip is turned out like this. You see the baby's lips wrapped around the areola. Their chin is touching or nearly touching your breast. That's how to know that you have put your baby to breast very well, position your baby. Then signs of good positioning. Your baby's head and body are in line. A baby cannot suckle or swallow easily if their head is twisted or bent. You see them struggling. And that is when, because once they are hungry, they get irritated easily. You will say the baby, I've tried to put the baby to breast, it's not sucking. It's because you're not positioning yourself well and the baby. A baby cannot attach well to the breast if they are far away from it. Your baby's whole body is supported with your arm along the back. Signs of effective suckling. How do you know that your baby, when you have positioned your baby, then how do you know that your baby is taking in something? Your baby takes slow, deep suckle, sometimes pausing. You may be able to see or hear. You will hear your baby swallow it as the baby is gulping in milk. You will hear the baby swallowing it. Then you know the baby is getting in something and suckling well. Your baby finishes the feed, releases the breast and looks contented and relaxed. Sometimes when they are done breast, when they are contented, you see them, they will just pull their mouth out from the breast and just be looking at you relaxed. You as the mother, you will feel light. When your breasts are heavy, you feel it. So, but when you breastfeed, your baby suckles on it, it feels more light. You even say, this one is light, come and suckle on this one. Breastfeeding position. Then, this is the one I demonstrated. This, you see the way, tailor sitting, this is where you sit to prevent back pain. Then, this another type of side lying. You are supporting yourself with pillow and make sure you are not feeling sleepy because you might sleep off and the breast will suffocate the baby. Thank you.
Thank you, Nurse Linda Okonko. That's a good job. Well done. Just keep your questions ready. We'll just move ahead. I know there are a lot of matters arising. We'll tackle them as we go. The head of pediatric nursing is getting ready to come now. Let's demonstrate how do we bath baby. Do we...
Alice, you come and stand there. Hey, wait.
Nurse hierarchy. Ngozi hierarchy.
Good morning, everyone. Standing on existing protocol. My name is Nurse Eric, and I'm the head of pediatric nursing department. I'm here to demonstrate on how to bathe your baby. So what is bathing? In a simple terms, bathing is the process of using water and soap or oil to cleanse the baby's skin, to remove dirt and bacteria from the skin. So why do we bathe our babies? What are the benefits of bathing our baby? Like I said, it helps to remove dirt and bacteria from the skin. It helps to prevent infections, skin infections. It helps to stimulate circulation, blood circulation. Then, for a very fussy baby, it helps to calm them down because warm water helps to soothe your baby. Then, during the process of breastfeeding, it is the ideal time to, during the process of bathing is the ideal time to check for your baby's growth and development. And it's also the time for you to check if there is any injuries, if there is any anomaly. That's when you have to dictate it. So as a mother, when you're bathing your baby, please pay attention to your baby's body. You will note if there's anything, any abuse, any form of thing, you'll be able to detect it. So, before you bathe your baby, there are some things you have to note and do before you start. Number one is that the temperature of the room where you want to bathe your baby should be warm enough. We don't encourage bathing a baby in a cold room. So if you have a warmer, you are the type that likes AC and the room is cold, definitely you have to heat up the room using warmer to warm the room before you start. Then another thing you have to do is to ensure that everything that you need to bathe your baby with is available and handy. As you can see, everything is here. You don't need to, the process of bathing your baby, you'll be running helter-skelter to get one thing or the other. And on no account should you leave your baby unattended during bathing your baby. It can be, anything can happen at that point in time. So, then, another thing is this, you have to wash your hands. We don't encourage long nails because you can actually wound our baby with it. And that long legs can also infect our baby because you don't know what you are harboring there. Sometimes we talk to mothers. You see mothers with long nails and painted nails. You'll be wondering, how do you even position to breastfeed your baby with the long nails? So as a good mother, you all are beautiful. You don't have to put on long nails, artificial nails and all that to look more beautiful. You're already beautiful. So please, cut your nails. For those of us that are due, if you come to the pediatric department to come and see your baby with long nails, we will not allow you. So please, cut your nails. Ensure that as you're washing your hands, you wash your nails so that when you want to bathe or feed your baby, you don't introduce an infection to your baby. Then everything is available. I have my cold water. I have the sponge, the cream, and everything. My cotton wool swab to clean the baby's cord. You have your diaper, your Vaseline. Everything I need is available and is handy, as you can see. So, then another important thing is this, please. We don't bathe our baby immediately after feeding your baby. You bathe before you feed. Even if you want to feed your baby, you can feed and just allow the baby to stay for a while before you bathe your baby. Because if you bathe your baby immediately after feeding your baby, it makes the baby uncomfortable and baby can spit out meal. On the process of even bathing, your baby can actually aspirate. So we don't encourage you to feed your baby before bathing your baby. I hope it's understood. So after ensuring all that, the next step is for you to wash your hands thoroughly. So I have to wash my hand. I will assume that this is baby Nancy. So this is my baby Nancy, and I'm going to bathe baby Nancy. So let's assume that this room is warm enough. We are just assuming that it's warm enough. And I will assume that I have washed my hands thoroughly. So the next step is, so this is my bathing bowl. And I will encourage mothers to bath on a kind of high surface so that you don't need to bend and hurt your back. If you have a back, you can bathing tub. You can actually sit down with that small stool if it's comfortable, but you can also put it in a table, high table, where you can stand and bath your baby, especially for those who undergone cesarean section. You don't need to put too much pressure on the sides. So this is our own bathing bowl. Okay. So the first thing you do is to put your cold water first. When you put your cold water first, okay. So you put hot water. Then you mix it. Remember, I assume that I have washed my hands because I'm not using a live baby. Then you use the heel of your hand to check for the temperature of the water. Remember that the baby's skin is thinner than the adult skin. And if the water is cold, it will lead to hypothermia, which is not good. We don't even want that for our baby. And if it's too hot, it can burn the baby's skin. So the baby should be warm, comfortable enough, as in warm enough, but not hot. So that's how the water should look like. So if you want to carry your baby during baths, first of all, we have to remove the baby's clothes. If you want to remove baby's clothes, you unbutton the clothes. We encourage mothers to wear baby's loose clothes, not the one that will be tight. Because sometimes for you to remove tight clothes on the body, you see them, you'll be struggling to remove either the hand or the leg. And the baby will be very uncomfortable and baby will cry. So we'll remove a baby's clothes gently. Always support the baby's head and the neck while you're removing your baby's clothes. You can turn your baby, then turn like this. Remember that, like I said, we don't want our baby to be cold. And some of us, I don't know if there's any grandmother here with us, or please. Some of us, even when the weather is very, 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 very cold, hot, sorry, you will see our mothers who will put on inner wear, overall, who will use that thick shawl to cover the baby, and baby will be sweating, crying. You have fed your baby, you have changed the diaper, the baby is still crying because you have overclothed the baby. The baby is sweating. If you want to know if your baby is sweating, just put your hand at the back of the baby's clothes. You will see and feel the wetness there. So you have to adjust. If the weather is cold and you are feeling cold, because they are human beings, if the weather is cold, hot, you are feeling hot, the baby is also feeling hot. So sometimes you don't need to overclothe your baby. You just have to dress your baby. The weather is too hot at home, you can open the windows and windows. You don't need to on AC. You just wear the baby the inner wears and stockings and allow the baby to be. But if the weather is hot, that's when you have to dress the baby very well, but not to overwarm the baby. No, overclothe the baby. No, because if you overclothe your baby, the baby will sweat. The body will absorb the heat, the sweat, which can lead to pneumonia. So you have to dress your baby according to the weather, please. So I have to remove the baby's diaper. So you look at how I carry my baby. With my left hand, this is my left hand. I will use it, put it under to support the baby's head and the shoulder. That's how I held my baby. Then with the right hand, I will slip into and use it to hold the baby's buttocks. That's how you lift your baby. You don't lift your baby like this. Sometimes don't support the head, they'll just do like this. The head will be dangling like this. So if you want to carry your baby, you use your left hand. If you are left hand, just use your hand, the one that is more comfortable. Use the right hand or the left hand, depending if you're right-handed or left-handed. Make sure you support your baby's head and shoulder. Then with the other hand, you support the baby's buttocks as you lift your baby like this. That's how you lift your baby, like this. So we'll go to the bath. So the first thing you do while bathing your baby is to clean the baby's eyes. That's the first thing you do. So I'm going to clean the baby's eyes. So I'll clean the baby's eyes without soap. From outside here, from inside, sorry, to outside. Then you discard it and you clean the other eyes from in to out. This is for you to remove any dirt from the eyes and to prevent infecting the eyes. So you discard. Then the next place to wash is the baby's head. So you hold the baby like this. Like I said, depending on the side that is more comfortable. If it's more comfortable on your left, you can hold the baby on your left. If you cannot do this style I'm doing, you can actually dip your baby in the water like this while still supporting the baby's head and shoulder, but we'll wash the baby's head. So first of all, then if you are using a liquid soap, you can put some drop or you keep it anyhow you want to do it. And when buying your baby products, please ensure you buy any soap and cream that has the same pH of the skin. Always check it. It should be in between 5.5. Some would say just 5.5 average. So always check what you're buying, because you have to buy what is as in the same thing with the pH of the skin to avoid any irritation or eczema on the baby's skin, because babies they easily have allergy. And we encourage for the at least first 1 to 3 months of life, if it's okay, if you can do it, buy a plain soap and cream, unscented soap and cream. We prefer that. So we start by washing the baby's head. You wash. You have to be careful not to pour water on the baby's eyes and mouth. Once you're done, you can now dip your baby in the water. So I'm going to dip the baby. With my left hand, I will support the baby's head and shoulder. With this my hand, I will use it to grab the baby's armpit. With this, you're holding your baby very firm. Baby can't slip from your hand. I don't know if you are seeing it. So I'm done washing the head now. I will clean the face. As you're cleaning the face, please avoid. You can use soap, but you make sure that you remove the soap thoroughly. Squeeze out the soap very well. Then you clean the baby's face. Avoid water entering the baby's mouth. So most times we prefer using flannel. Those small flannels is more preferably. It can actually clean the baby's body better. This one is also okay, but the small flannel is better. It can clean the baby body very well. So it's your choice. Then the next place to wash is the baby's neck and the chest, stomach. That's the next place to wash. After washing, you wash the hands, the arm. You pay attention at the areas of the folds. Very important. You wash the hand. To the extent, you go to the fingers and wash. Then go to the leg. Wash the baby's leg. Please, as you're doing that, you have to be very fast to avoid cold. So once you are done bathing, washing this side, you will now use your right hand. This right hand, to grab the baby's armpit. See how I'm turning the baby. I'll let the baby come to my hand like this. Then I will use the left hand to bring out the legs. Then I will wash the baby's back. So after washing the back, so for first-time mothers, on your first day bathing your baby, you might feel very anxious and very uncomfortable. Relax. As you continue, both you and your baby will start enjoying the bath. So you can be anxious, don't worry, it's normal. Even babies, most times their first bath, they will cry and cry. It will be like, did you commit any crime? But with time, you see the baby enjoying bath time. So we are done. So what the next thing to do now is to rinse the baby's body. So rinse the baby's body. Wait. Yes. So you repeat the process of putting the cold water and the hot water. Put. Okay, put the hot water. It's okay. The hot water. Hot water. So I'll still use the heel of my hand to check it. It's warm enough. We'll now rinse our baby's body. Please, as you're rinsing or you're pouring water, make sure that you cover the baby's ear to avoid water entering the baby's ear. Because if water enters the baby's ear, it can actually cause ear infection. So you repeat the same process. Wash the back of the baby. And we are done. So you dry your baby's skin. So the next thing I will do is to clean the baby's cord. I have my spirit swab here. I will clean the baby's cord. So you clean baby's cord. You clean inside out. You discard it and clean the other side. Then clean the top and discard. Please, it's very important to always clean our baby's cord. Before, we encourage mothers to clean baby's cord every 3 hours. But now, we no longer encourage that. We want you to clean your baby's cord at least 3 times a day. That's to make that area to be dry, to dry off fast. Then, but when your baby poo and you are changing the diaper, please ensure that after changing the diaper, you wash your hands again and clean the cord. Then these are pampers. Some of us, we don't know how to wear baby's pampers. You will see these pampers now. We did competition, men. We asked our daddies to come and put baby's pampers. It was a joke. So I know that if I ask daddies now, which side is supposed to be in front or behind, they don't know. So this place with this, is it wings or what? Yes, it's the side that will be at the back. Here will be in front. So just use this thing to differentiate where to be in front or to be at the back. So it's this side. We'll now wear our baby pampers. When you're setting the things for bathing, please ensure you keep two, because anything can happen. You might want to change the baby's diaper and baby will just wee or poo on you. Even the clothing, you change. Then you must oil the baby's buttocks. You have to apply Vaseline on the buttocks of the baby. You apply from front, then you go behind. Then for a male child, please, as you're bathing the baby or you're cleaning the baby, always raise the scrotum up. Because if you don't do that, there will be a pile-up of, baby can easily get infected from that area. So if you are cleaning the baby's diaper, you have to raise the scrotum and clean it very well. Then for a female child can enjoy the bathing time as long as you, the mother, is comfortable bathing the baby. But for a male child, we don't encourage you to leave the baby in a hot bath for a long time. This is as a result of the testis. It's still growing, it's still forming. So we don't want anything that will come and shrink our baby's testes. So the bathing time of a baby boy should be minimal. I don't know if you understand. We don't have to use very hot water on our male babies, and they don't have to sit on a bathing tub for a very long time. So you have to be fast in bathing the baby. That's just the difference between bathing a male child and a female child. Then most times you have to put the pampers on before you even start creaming the body, in order not to mess the surface, because baby will not tell you I want to poo-poo. They can poo-poo at any time. So you now oil the baby. I'm just assuming of oiling the baby of any of your choice of cream and soap. So we oil the baby's skin. Learn how to position your baby, very important. Even after feeding your baby, you don't have to raise your baby up like this to change the baby's diaper. This can actually cause aspiration. It can cause the baby to spit milk, and it can make the baby very uncomfortable, especially after feeding the baby. So if you want to change the baby's diaper, don't raise the leg like this. Most times it's very uncomfortable. You can change it by turning the baby like this. You put the pampers, then turn to this side, draw it, and you wear your baby's diaper. Then, like I said, if the weather is too hot, please wear only the inner wear and the stockings and leave our baby. Some of us, even during the hot weather, will still put cap, and most times the babies come down with rashes all over the body. Then we encourage you to oil the baby's hair, but not too much. Some will just oil it, that when you touch the baby's head, you use it and apply cream for 10 babies. No, you see the baby will sweat, the oil will drop to the body, and all over the baby's body, skin will be filled with rashes. So when they just apply you don't need to, even when you apply it, you don't need to wear the baby cap, unless if the weather is too cold. Allow air to enter the baby's hair. So wear the baby's. So remember that the towel is cold. So you have to remove the towel. So if you want to wear baby's clothes, you first of all locate here. Put your hand and draw the baby's hand like this. You don't need to start forcing the baby's hand and force it and force it. You can injure the baby. So you first of all put your hand in the clothes, then gradually grab the baby's hand and bring it. It's seamless, like doing like that. You turn the baby. So wear the inner wear. So I'm still repeating the same thing I did before. And as you're bathing the baby, please, it's also the avenue to bond with your child. Talk with your child in as much as you want to be fast. But you can as well play with your child. Not to bone and be bathing baby. And baby will be wondering what is happening. So you can smile, mention your baby's name. You can even sing for your baby. That's part of it. You can play music during bathing time. Baby will enjoy the bathing time. So this is the cap, which is not compulsory. Air should enter the baby's head. Then this is the shawl. This is not a live baby. If not, by now, this baby will be sleeping because bathing induces sleep. Once you finish bathing your baby, most times they sleep off. So bathing induces sleep. So I want to encourage us on another thing. Some of the harmful practices our mothers exhibit or we practice that is bad. You know that massaging of our baby is something that you do, and it should be a subtle massage. But you know that out of ignorance, God overlooked during our time. If it's now, maybe most of us will not have hands and legs. Maybe we'll be limping, or I don't know. Maybe our legs or hands, maybe by now, is amputated. But God just overlook everything because they don't really understand. Please, you can massage your baby, and it should be a gentle massage, not the one that you, baby, a 3 days old baby will be going for gym. When you want to massage, like this, like this, like this, you will shake the baby. Please, let's have pity on our babies, please. We so much cherish these babies. And in as much as you're the one that carried this baby, once we receive this baby, we feel it's our own, and we don't want anything to happen to our babies. Please, this baby is not going for gym or I don't know what to say. Please, you can massage your baby, subtle massage. After bathing the baby, you can oil the skin and give a baby a very subtle and smooth massage. It's allowed. But any vigorous one, we don't encourage that. Please, our daddies should help us tell mothers, grandmothers, because most times it will be as if you are fighting with them. You just have to let them know that it's not allowed. Because on the process of doing these things, some will even turn the babies upside down and be shaking baby like this. You should remember that this baby, they have tiny, tiny blood vessels which can rupture especially on the baby's head. The blood vessel there, tiny blood vessel can rupture, and it will lead to a lot of bad things. You wouldn't want a baby you carry it for 9 months because of harmful practices. Baby will come down with, as in bell palsy, something that you will regret all the days of your life that can affect your baby. Please, always supervise whatever grandmothers, anything they want to do, please always supervise and correct in love. Don't be aggressive about that. Let them know. Then, another thing is the cord. Some of us, we don't have patience at all. Some want that baby's cord to fall within 3-4 days. They will be worried. Please, when you give birth, some baby's cord very thick, some are thin. You cannot compare that the big one, the one that is big will fall the same day the one that is thin will fall. No. Some cord can even stay up to 10 days before it will fall. Don't apply anything. Some will go and apply toothpaste. Some will apply a cow dung. Some will apply all sorts of things. Please, that is the avenue for infection. Any wrong miss, if infection enters through that thing, is disastrous. It's a complete sepsis. That it will cause sepsis, which you will not like. because there will be a hospital admissions and you will pay. It's not cheap. I don't have to use your baby to entertain such. Then also, we don't want you to expose our babies to too much perfume. We don't even encourage, some of us, we have camphor at home. If you know that you are about to give birth, please remove all the camphor in your house. Those who want to paint their houses, please paint it now and allow it to dry. We don't want anything that can cause allergy on our baby. Please, you don't use our babies to entertain visitors. That is another one. We don't want, some of us, when we want to bathe our baby, we will now put Purite, Dettol, and all that. No, we don't allow Dettol in the baby's water, please. The baby's skin is very thin, and we just want plain soap, cream, and water, so that if the baby is reacting to anything, we can trace where it's coming from. But when you're using some will go and buy organic soap and cream. Some of them, they must have missed one chemical or the other. We don't want that. That's why some babies are coming down with skin cancer and all that. Allergies everywhere. So please avoid harsh perfume close to our babies, camphor, dusting powder, rub, menthol. We don't want it around our babies. I think that's it. So please, let's try and take care of our babies. After 9 months of journey, you wouldn't want your mistake or my mistake to ruin our baby's life. Thank you.
Thank you very much, Nurse Ngozi and Nurse Linda. Please take your seat. The head of the Department of Pediatrics is very busy. Head nurse, you'll come and talk later. I know our patients have been sitting for too long. MD is getting ready with his incisive contribution, questions, and all that thing. But we'll give him opportunity to the end. Start getting ready with all your questions and answers. Ebony West, please come forward. Our patients are sitting there for too long. I want us to sing one love for them. Be straightening your legs, be moving your legs. Those of you that are permitted to dance, you can do old school with your husbands and all that. Be getting ready. Head nurse and a deputy are moving around with papers, and you can jot down your questions and we'll take them one by one. But hierarchy. Throughout, I saw somebody standing by you. You didn't mention who is that person.
Oh.
Yes. The person that is standing. You explain to us when you come to answer question. Huh? Well done. This thing that you're using your elbow to do, is there any scientific way we can do it better? We give patients thermometer.
Yes, you can use thermometer.
Yes.
You can use better.
What is the temperature? We're in the period of science now. I think we're talking
yes,
about fluorescence again.
38 degrees.
When you come to answer, you'll tell us more about that.
Yes, sir.
You say baby must be fed, and the mother will be satisfied, baby will be satisfied. Baby will be satisfied, baby will not satisfy, mother is tired. And it's fundamental baby's right to be fed. You must come and tell us how would baby mother satisfy later. Well, I'm sure MD, there will be several questions and answers. We'll give you time. But let's listen to one love. Just stretching your body a little bit, and then we can start questions and answers.
I'm a bit in thermometer.
and I will feel alright. Saying, let's get together and feel alright. Give thanks and praise to the Lord, and I will feel alright. Saying, let's get together and feel alright. Give thanks and praise to the Lord, and I will feel alright. Saying, let's get together and feel alright. Give thanks and praise to the Lord, and I will feel alright.
That's Bob Marley of blessed memory. He died 42 years ago. I think in 1981, in May. Can't remember the date, May 11 or May 17th. Bob Marley of blessed memory, one of the greatest hits. The scripture says that what is the greatest commandment? Say, God, love God, and then love your neighbor. Love your wife, and make sure that you love your child well, that your child is well protected. Head nurse, I know you are moving around. You want to make some comments before we start? You are the one that will be anchoring this part of the questions and answer before the CMB comes. Dr. Charles has still not come in. He's busy in the NICU. All right, so maybe we'll start with the head nurse. Maybe you come and introduce yourself and start with the first question, and then we move on from there.
Good afternoon, the Chief Medical Director. Good afternoon, our Director of Clinical Services. Good afternoon, Deputy Director of Clinical Services. Our consultants here present, Dr. Barrow, Dr. Bendo, good afternoon. Our Chief Resident, good afternoon. Ladies and gentlemen, good afternoon. Thank you, sir. I believe we have learned a lot today. Because even from the few questions I started connecting, I can see we have learned a lot. Because I believe you can't ask a question when you don't understand the topic. So, but I still just want to encourage us mothers. I believe we have heard much about the benefits of exclusive breastfeeding. And I believe we are ready for that. Because the truth is the best food for your child, the ideal food for your child. It is safe, it is clean, it is readily available, it is healthy. You don't need much to do about it. All you need to do is just make sure you wash your nipple. Wash your nipple properly. That's all you need. And make sure you position your child properly. We have seen 5 different positions. But just like she said, there's one position she talked about, the side lying down. I'm still encouraging us not to do it. Please, it's not the best. Because we are human. Sometimes you will slip off. And your child will end up suffocating. So please, our advice, let us not even go for that position. Let's go with the 4 positions. Please. And I still want to encourage us. We have learned much about baby birthing. Some others will say, okay, I don't have a standing birth. You can actually sit down and practice all what she did. And you don't have a standing birth, you don't have a dressing table, isn't it? After birthing your baby, you can lay your baby on your bed and dress your baby properly. Do we understand that? So as we continue to connect the questions, we'll attend to them one after the other. Thank you very much. Thank you all for coming.
Let's have the first question.
Thank you, sir. The first question says, You had a presentation on exclusive breastfeeding, but there are some mothers that have difficulty generating milk. What is your advice to those mothers? Do you want me
She's
to-
on that. Okay. Thank you for that question. Like I mentioned, we have breast milk bank in our hospital. So we advise, pending the time your breast start producing milk, you can buy breast milk from our breast milk bank if truly you want to practice exclusive breastfeeding. So once your breast start producing milk, you can start breastfeeding your baby from your own breast. Are you clear? And also, while you're waiting for your breast to start, the breast milk to start coming, we usually encourage you to take, if it's normal delivery, take enough fluid, warm water, take mothers, they know some cookies that helps in the production of breast milk. Take natural liquid, natural drinks like kunu, pap, tea, enough tea. All those things will also boost the milk production. And even as the milk is not coming, it's advisable that you just be putting your baby to breast, because as they suckle, it sends signal to the brain and helps in the milk production. Thank you.
So, sorry, another thing you can do is to do breast exercise. So you remove your bra and exercise your breast. You shake your breast. Breast exercise. So when you shake it, constantly shake your breast. So that's breast exercise. It will make the breast to be full again. You can now, baby can suck or you express. So breast exercise is very, very important. For those that deliver via cesarean section, as you're doing that, you can as well support your tummy and exercise it. So ensure that you exercise your breast. Thank you.
Thank you very much, Nurse Linda and Nurse Ngozi. We may be having challenge establishing or maintaining and starting breastfeeding. Some babies may be delivered, they may have to stay in the neonatal intensive care unit for a while, maybe preterm babies. So sometimes babies may remain there, and starting and establishing breastfeeding may be a challenge, and picking it up may be a challenge. In addition to the little things that they have said, putting the baby to breast milk will make babies start breastfeeding. The first 2 to 3 days is the colostrum that is actually coming out. But within 3 to 5 days, before we say a woman has a failed established lactation, it will take at least 5 days. We encourage, that's one of the rare places again, those shows tend to discourage breast pump, but there's a place for breast pump that will encourage mothers to start using before they finally move to the use of, before they start breastfeeding directly themselves. And then finally, if it really fails, there are drugs that we can actually give, but we really not to want to give drugs. Myself, Dr. Konko, Dr. Barrow, when we know there are drugs that the pediatricians will tell us, can we give the parents or the mother to be able to establish breast milk? But if you are then throughout the breast, please make sure your breast is examined at least once throughout your pregnancy. If your breast has not been examined by your gynecologist, ask him, if you examine my breast, can I breastfeed? There are inverted breasts. The breast may not be pointing. It may turn inwards, so we call it inversion. So, and you need to be cleaning your breast at least 1, 2, 3 times in a week. So just ordinary water and cotton, just clean the breast so that the spores, there are about 18 to 20 small holes there from where the milk gets out to the baby. So just learn to clean it now. Husband, breast is no-go area, but you can help your wife to clean the breast at this stage. Don't stimulate it, don't suck it, if you are not permitted to do so.
Thank you, sir. And I think your contribution have answered our second question. Because the question says, how do you prepare the breast for lactation stroke breastfeeding, and how do you care or prevent cracked nipples? I think our DCS have talked about how to prepare the breast for lactation. Just keep washing your breast at least 3 times a week. Then how do you prevent cracked nipples? Actually, during her presentation, she talks about positioning. You have to be sure the whole nipple is inside the baby's mouth. That can help to prevent cracked nipples. Thank you. The next question is to Nurse Eriken. What is that white thing you use in cleaning the baby's eyes before bathing?
It's cotton wool or gauze. You can use flannel. So cotton wool or gauze, or you use flannel. That's why I said you can buy, there is one flannel, I think comes in 8 in one pack or 10 in one pack. So you can have that. You can also use one of it for as your baby's wash towel.
Thank you. The next question here says, during hot weather, fan and AC, which is better for the newborn?
Please, AC is better for the newborn. But you have to regulate it. It should be between 25 to, when you put on AC, even as an adult, when you're cold, you tend to regulate it. So when there is a baby in the room, you can put it at 25, 26, 28. But if you notice that the room is getting very cold, you can either off and on, or you put it at 29. I don't know if I've answered the question.
The next question here says, what is the place of breast pumps, especially for distributing cholesterol for multiple babies, to ensure they each get enough?
Like the director of clinical service has said, you can use breast pump if you have multiple babies, but it is advisable, even if all of them can get a little, just put them to breast, or you use breast pump to express colostrum. Let them get a little of it because of the immunoglobulin it has. Let them get a little of it. It is important, because I know it's hard to do exclusive breastfeeding for multiple babies, but at least as you're doing formula, make sure you also breastfeed them. Don't just abandon them and leave them to formula. When each time they cry, you say, go and give this baby food while the breast is there. Thank you.
So, head nurse, sorry, let me add to this. Some mothers, because of our working schedule, some of us, we don't even have the zeal again to breastfeed our baby, exclusively breastfeed our babies. If you are determined to breastfeed, do exclusive breastfeeding, you can actually achieve that. You have to be patient about it. You have to remove any form of worry, because if you start worrying or start getting agitated, it's going to affect the whole process. So if you are determined to exclusively breastfeed your baby, it has to go with a lot of determination, and you have to work for it. What do I mean? You have to, like I said before, do exercise, breast exercise. You have to take warm fluid. Then another way to go about it is to get your breast bag. We have a sterilized bag, breast bag, where you can store your breast milk. Some of us, the first 2-3 weeks of after delivery, you lactate so much, but with time, because of stress and everything, the breast milk production tends to reduce. So at that particular time that you are lactating very well, we actually encourage you to get the bags, then use your breast pump, express as much as you can express, and store it in the freezer. As you express, you label the dates, you put the dates and the time, and you can dedicate a freezer, or you know how you do it, a compartment in your freezer where you store it. You can use a Ziploc. So the one you produce today, you put it in the Ziploc, label the dates and the time. If you want to use, you start from the previous one and use. And it will not still prevent you from continuous expressing. At least with that, for those that deliver multiple babies, you can at least breastfeed your baby for like 2 to 3 months exclusively, which is a very good thing. Thank you.
Maybe what we'll just do, we just take as all of them, if possible. Those that are overlapping, we just overlap them. When MD comes to round up, you try to incorporate all questions. We need people to understand these topics very well and go home with it. So maybe just take all the questions at once. Those that are remaining, when MD comes to round up, you add.
Thank you, sir. The next question says, how do you breastfeed 3 babies?
We've answered it.
I think that has been answered. What is the best way to sterilize? Another question says, is using swaddles good for baby?
Yeah.
Swaddles.
Yes.
These wrapped swaddles. Yes, sir. What's the advice for mothers of multiples? How do they manage with breastfeeding? It's almost the same question. Breastfeeding timetable. Is there any need for making a timetable for breastfeeding our babies, or we give them or feed them on demand? We were told that there is a breast bank in the hospital. Please, is it safe for a baby to take breast milk from someone else apart from the mother? Another says, how long can express milk stay in or outside the fridge before feeding the baby with it? Do we have to bath newborn babies every day, especially from 1 to 6 months? Is the amount of folic acid in pregnant care enough to meet the baby's needs, or is there need to take extra? Folic acid in pregnant care. After CS delivery, is it advisable to start baby on formula feeding first before transiting to breast milk when the mother is stable? How do you wash the female child's genitals? What if you are not lactating properly in the first few days of birth? What do you do? What fruits are suitable to encourage milk production? Thank you, sir.
Yes, sir. Okay, how do you wash your baby's female genitalia? Like I said, you use your flannel, your water, and wash it. You can apply just soap and squeeze out the foam and wash it, because sometimes newborn baby girls, they have secretion, which is normal, so you have to wash it. You have to wash that part very well, please, to avoid infection. Then about how long breast milk can stay. Breast milk can actually stay in the freezer. Okay, after removing it, like if you express breast milk, newly fresh expressed breast milk can stay within the environment, as in outside, for up to 2 to 4 hours. As in the one you just expressed, you can use it. But when it's in the fridge, you should, it should be exhausted before. As in, you have to finish the one in the fridge within 2 to 3 days when it's in the fridge. You don't have to allow it to overstay. But in the freezer, it can stay as long as a year, 6 months to 1 year. Yes. So like we have answered the questions, what you have to eat. Like I said, do your exercise, take a lot of warm fluid. Your fluid should be warm. It's breast milk cookies that you can eat. Eat rightly, exercise, do exercise, engage in small breath, even physical exercise, mild one, it will also help. Then there is no time for baby to suck. Baby should, as far as you are doing exclusive breastfeeding, baby should suck on demand. You breastfeed your baby on demand. Please, as you're breastfeeding your baby, there is what we call burping of your baby. Most times you see, I've seen 1 or 2 or 3 mothers that once the baby burps, some babies, they used to bring out feeds from the nose and mouth. You see them, they become very afraid. There is some little things you can do to save a baby at that point in time, because we have seen a mother rush baby to the hospital, arrive at death, baby is already dead before even we start attending to the baby because of aspiration. So we should know what to do when we are feeding our baby and baby starts bringing out food from the nose and mouth. The only solution before you start coming to the hospital is to ensure that this baby cry. Anyhow you will make the baby to cry, do it, spank the baby. That spanking. Okay, you have to turn the baby. Let me demonstrate it with. So there is what we call a syringe bulb. It's mostly in the feeding bottle pack. So it goes a long way to help. Most times when our mothers deliver, we usually talk to them about that syringe bulb. What you do at that point in time when you are alone, there is no help, is to squeeze the syringe bulb in, then put it in the nostrils or mouth. As you are removing it, you are releasing the bulb so that it will milk and syringe out whatever that is blocking the airway. Because if you don't actually do anything, you see your baby turning blue. So you have to clear the airway. Another way to go about it is to turn your baby like this and just hit the baby, tap the baby's back very well. If the baby is not crying, pinch the baby, just do something. Once the baby can cry out, at least to clear the airway, baby can take in air before you start bringing the baby to the hospital. Please, we should remove fear. One patient had to run out of the room. My baby is dying. She did not even remember what to do, and we finished educating her on that. Please, I know sometimes, especially first-time mothers, we can be afraid, but please, let's try and do that basic things you are taught. It can go a long way to save our babies. Aspiration can kill a baby before you know it. That's for that.
Thank you very much for your patience. We know these are very important things today. We have a combo of discussion today, and we'd like to now invite the Chief Medical Director, Dr. Johnny Daosa, to come, and let's listen to him carefully. Because you may have to come back again and answer some questions. But let's wait
okay.
for you.
So with the final one, formula for cesarean section. Like we said, we have breast milk bank, but it's very safe, as in we screen. That we've been doing that for years. We screen and screen and screen. There is a process and a protocols for us to get our milk. So it's very safe. But and it's expensive also. I must tell you, it's safe and it's expensive. But for cesarean section, we encourage, especially for preterm baby, because we can't even start our preterm babies with formula, because we have to prep their guts. We don't want any, like she mentioned, neck. We don't want our babies to come down with neck. So most times we commence them with breast milk. Then you can switch over to formula. We know that it's not easy to do exclusive for multiple babies. Notwithstanding, like she said, the basic thing is you as a mother, as a parent, not only the mothers, the father should assist the mother. They should assist both in caring for this baby, in feeding the babies, because once puerperal psychosis, let me not use that word, once puerperal depression sets in, it is not good for both the family as a whole. So our daddies, please, you have to help our pregnant mothers during pregnancy. When they deliver, you have to care. Carry your baby, feed your baby. If possible, bathe your baby. Let your wife have rest. Because if she doesn't have enough rest, it's going to affect her mentally. And once she's affected mentally, breast milk production will drastically reduce. So she has to be very, very comfortable about that. I don't know if we have touched the
Thank you,
questions.
thank you, Dr. Sir. We can't exhaust everything, but we'll continue. Even in the clinics, you can ask. You can also come to the pediatric department and ask questions.
Thank you, presenters, and thank you, students, for coming. Wow, it's quite a large class today. Okay, let me just add science to a lot of things you've said. The breast is a factory. And once you give raw materials to the factory, it will produce the products. Then why, if it is a factory, why does it not produce its product while you are pregnant? The reason is because there are inhibitions. The placenta is there. It is the placenta that is preventing the breast from producing breast milk while you are pregnant. So if you see if your breasts start bringing out milk while you are still pregnant, it means your placenta is not functioning well and your baby is in form of danger. I hope that point is clear. Now, the rule of the thumb for how you store milk, we call it that the rule of the force, saying that if you express milk, you gotta go to work and keep it just keep it in normal temperature. Oh, it can last for 4 hours. If you keep it in an ordinary fridge, it can last for 4 days. But if you keep it in the freezer, 0 degrees, it can last for 4 months to 1 year. So 4 hours, 4 days, 4 months. So that's, now for washing the female genitalia, don't poke your finger into the girl's vagina, please. You may notice, for those of you who give birth to girls, that all of a sudden you are seeing blood coming out from the girl's vagina. It doesn't mean that the girl has been molested, no. It is normal for a girl child to produce, to secrete, for blood to come out from the vagina after delivery. It's all about the placenta, the effect of the placenta on the girl's uterus, and as if the girl is menstruating. Don't be bothered. It's normal. It will stop. For those of you carrying twins, triplets, and quadruplets, it's good you know that when you are breastfeeding from one, the other breast is also bringing out milk. Husbands, it is your job to now sit by the other breast and help the baby to latch on the breast on the other one. You know, I have a set of triplets, so I know this is what I did. There is no how to prevent it. That's why I'm happy the fathers are here. We'll go to the fathers. I hope you now know how to latch the breast and the baby. For Linda, I want to know, there's this rule. Is it that the mother should go towards the baby, or the baby should come towards the mother when during breastfeeding? How do they do it? Mother to breast, mother to baby, or baby to mother?
Baby to mother.
Baby to mother.
Yes,
Okay,
sir.
please, it's important. I have more questions for you. If a woman's breast is small, does the milk that is produced, is it a function of the size of the breast?
No, sir. Irrespective of the size, it produces enough milk for your baby.
Okay, so you don't need a big breast
No,
for
sir.
plenty milk.
Yes.
Okay, that is very reassuring. It's also, I want to also know, does the social status of a woman affect the quality of the breast milk? You understand what I mean? If I'm a rich mother, does the breast milk, is the breast milk richer than that of a poor woman?
No, sir.
So it's same.
It's same.
Okay. So it has nothing to do with your social status and it has nothing to do with war. The only thing may just be maybe the poorer woman may not be more relaxed. And so it may not affect the quantity. But let that woman drink milk. God has made it in such a way that there is no distinction between the poor woman and the rich one. Now, it's, you mentioned that there are some women who cannot breastfeed. You see, the discussion is good. I had a patient who went to the United States to deliver and got to Germany, changed the flight from Frankfurt. And so it was time to, they were landing. I know when you get in from Frankfurt around the Kano axis, they start telling you prepare to land. And this woman, having been told that, say, to protect the ears of the baby, ensure the baby is sucking something, started breastfeeding. By the time she landed Abuja International Airport, the baby was dead. Just dead from aspiration because she did not know how to bump the child. So it's important to know. I had a wife, a very distinguished citizen of my country, and she had delivered. It was time to breastfeed. And I went in with the mother-in-law to try to encourage her to breastfeed. And then thereafter, they left. The woman called me aside and said, "Doctor, I forgot to tell you that I had a breast implant. I have silicone. So I won't be able to breastfeed." So it was now my responsibility to go and clear the ground again and give medical reasons to the mother why she cannot breastfeed. Oh, the lie we say, if not that God have mercy on us. So the question, those who have done breast lifting, breast implants, can they breastfeed?
No,
They can't breastfeed.
they can't breastfeed.
So please, which means before they do the breast implant and all those things, they should finish breastfeeding first. Something like that. Because you talked about the lying position. If you lie, Linda, if you lie on one side, can you breastfeed? From what I'm saying. If you say head nurse can breastfeed, I understand. You can't breastfeed from lying down. Erica, please come. How many children do you have? You know, well, I like experience. Please come. Erica, please come. I have a question for you. You know, it's time to ask question and answer. How many children? I know what kind of question to ask. How many children do you have?
Sir, 3, sir.
Okay, so you have experience. Okay. How many times should we bath a baby in a day, actually? After all, the baby did not go to work.
Yes,
His baby
sir.
is not dirty.
In this part of Africa, basically, you can bath your baby like 3 times in a week. But in this side of Africa, at least once a day. But you see, some mothers will insist, especially the first 3 months of life or 2 months of life, you can decide to bath the baby at night once a day. Then subsequently, you can clean with just plain water. For bathing of baby, you can bath just once a day, or if the weather is too cold, you can bath like 3-4 times in a week. But I know they will not agree, sir. So they will bath morning and night.
No, they have to agree. They just have to agree because the baby does not have body odor. No, people think that people develop body odor because their mothers did not give birth. No, it's not true. The baby did not go to work. So I think once a day is enough.
Once a day is
Once
fine.
a day is enough. After all, you could have given birth to that child in Finland or in Russia. Will you bath a baby every day in Russia or in Finland? You won't do that. So if the Russian baby is not smelling, our own will not smell us.
Then if you also bath your baby, morning, afternoon, we bath 3 times in a day. It can even predispose your baby to
No,
atopic
3
dermatitis.
times a day, no.
The skin will become very dry.
Morning and evening, no. No. The child didn't go to work once a day. Now, Erica,
Sir?
you know when you were coming, I said you are fine. The reason I think you are fine is that when your mother gave birth to you, she did a molding. She molded your head. After bathing, molded your head. Molded your nose. You know, like this. You don't think it helped you?
I did not remember that. It's one of the harmful practices that we mothers we do. So please, let's just bath our babies normal. The most important thing you do is positioning of your baby. You don't allow your baby to lie down on a particular, like your baby's bed in a cot. At least when you lie the baby on this side, try to lie on the other side. You also let the baby lie on the back. By that time, even if the baby's hair one side is big, as the baby is growing, everything will rhyme up.
Okay.
Please don't massage the baby with hot water. It can rupture the tiny blood vessel in the brain and it can cause wonders. Please.
And
Then
so
as
I
for
no
the
need
nose,
to do the nose.
and for the nose, like I said, you can do a subtle massage. There's nothing wrong, sir. You can just subtle
touch
one,
it.
subtle. Just do like this to your baby. I don't think there's anything bad. But when you now start using hot water to do it, massage it so that it will stand up by force, that one is child abuse.
That's child abuse. There's this thing that does like this.
The front.
The reason why my own clothes sometimes come, my mother used hot water to.
No, sir.
Press.
Hey, God.
So I could have died or what?
Sir, you don't, please. There is some people who go to native stuff. They will miss one concussion and ask them to place it on. It will close with time. It's fontanelle.
Yes.
Please, it will close. Sometimes it can take up to 18 months, 6 to 18 months to close. Allow it, it will close.
So no problem.
Don't put hot water. Don't put anything. It will close. That's how the nature is.
Okay. Erica, when I was young, when I have hiccup, when my mother puts a thread of white hair on that place, the hiccup stops. Did they do it to you also?
Yes, sir. That one is not harmful because it's what you believe, and sometimes it works. Actually, there is no scientific rationale behind it. But sometimes, I don't know, it's because it's our belief, what we believe. When you do it, you see that it will work. But there is no scientific rationale behind that.
Okay.
So
fine.
hiccuping is good for the baby. It helps to expand the lungs, so it's okay.
Okay. Now, there's also something my mother did to me. She put methylator in my anus after bathing. Did they do it to you?
No, sir.
Did they do it to you? Now, I'll tell you what my mother did and how it has helped me in life. After my mother gave birth to me, she did me like this. And today, I'm not afraid of height. Did they do it to you?
Yes. But please, we don't have to throw our babies. Number one, the baby can fall. Number two, they are very, like I said, these babies are so tiny. You don't have to do that. Anything can happen. Like I said out of ignorance that God overlooks. That time, God was so merciful. Very, very,
so
no,
I would
he's
have
still
died.
merciful. Yes, but let's not do all this, practice all this harmful stuff.
Okay. Now, you'll be talking about this. I noticed you poured water. When you was trying to rinse the baby, you poured water back into the, I don't understand. Is it you poured new water to join the dirty water? I don't understand.
No, now. The dirty water, look at it now. It drained through this part. This is how it is.
It has a tap.
Yes, it drains out through this place.
Okay, you didn't tell us. That's why I was wondering.
Okay, it drains through this place. You can see it.
Okay, why then can't I just bath my baby in a bath? Just allow shower. Why can't I do that?
Hi, sir. You can't control the flow of the water. Baby can aspirate during this process. And we don't want water to enter the baby's mouth or the ears. So you can't just allow bath with the shower.
So it's a no-no.
And you can, yes, it's a no-no, sir.
Okay. Now, you talk about us cutting our nails.
Yes, sir.
Oh, Erika, you don't understand. The women, the girls of these days must have long. Are you saying our mothers should cut their nails?
Yes, sir.
So it's a must.
It's a must.
Tough.
If you don't and you come to my Nico, you will not carry your baby.
Husbands,
You won't touch your baby.
I know you spend so much on those nails. If your wife must bath your babies, she must cut her nails. Now, what about the baby's nails? Don't they cut it?
We cut babies.
How often do you cut a baby's nails?
It depends. Like some babies, their nails grow often. So, but you have to be careful because we've seen mothers, they will injure the baby on the process of cutting. Some will use their teeth to cut it. But it's not hygiene to use your teeth to cut babies' nails. But sometimes mothers, they are more comfortable using their teeth to cut the nails. But we have small nail cutter. The way you do it is that, I don't have a nail cutter, I will have. Anyway, once you deliver and come to the NICO, definitely we will come and see you. I will tell you how to cut your baby's nails. You make sure that the nail cutter.
Okay, don't worry. So are you suggesting they should come with nail cutters so that you teach each mother how to cut the baby's nail? You can't be using your teeth. Since you are not a vampire, you are not a witch, you cannot be using your nail to cut, your teeth.
Your teeth to cut
So please, you will teach us. Just 3 more questions. You say we should cut our nails. What about mothers with long hair? And while they are bathing the baby, their own hair now enters the water. What's your recommendation?
No, you wear your cap. So you cover your
They have to wear cap
Yes, sir.
and cover the hair.
Yes.
All right. I just want to be sure they know about that. All right. You talked about breast bank. Yes, it is true. We have a breast milk bank here. Don't worry. We have screened those people who screen the milk from the mothers who give this milk that have been thoroughly screened. So don't be worried. But custom and tradition makes many women throw away colostrum because they call it the witch milk. Please, it's not a witch milk. It's not from the witches. It is the most important part. 1 drop of colostrum is better than a bowl of eba in your meal. Okay, that's how important it is. Now, you talked about the umbilical cord. Enrique, after you have done the pampers, should the umbilical cord be inside the pampers or above the pampers?
It should be above. It should not be inside the pampers. It will have to be visible so that if there is any infection, if it's bleeding, you are able to detect it. Please, it should not be inside.
2 more things. Erica, there is really no wonder milk. There's no wonder formula. I've heard SMA Gold, SMA Pro. I've even heard of Enfamil. There is nothing that can take the place of breast milk. Now, you say that people should breastfeed for 6 months. Let me for those of you who are carrying twins and triplets and quadruplets, no, you will not be able to. From day, maybe from day 0, you will notice we've started adding some help because you will not produce enough to go around. But we have a breast milk bank. The more you put your child on breast milk or your child uses breast milk, the better. If you are not afraid of anything, please be afraid of asthma, be afraid of eczema, she talked about, be afraid of childhood obesity, and be afraid of infection that the breast milk can protect your child from. I think basically it's been a great day with your department, and I want to thank you. I again want to say thank you for keeping a lot of babies alive. I'm aware presently that we delivered a baby of 26 weeks one day, a set of triplets. They are with you presently. They've gone through 12 days of life. And in the yesteryears, if you deliver a child of 26 weeks one day, you take the child and throw away. But in this day and age, this pediatric team has the capacity to keep those kids alive. We will not deliberately do it, but if it happens, we have what it takes to make sure those babies are alive. I'm also aware that we delivered a 26-weeker. The head of the Department of Pediatrics is not here today because we are presently undergoing a neurosurgery on a child that was delivered at about the 26th week. the course of delivery, the child's vessels are very tiny, and so a little injury here and there, and so it causes one or two blockages. And we are using the power of science to remove those blockades and make sure those kids, that kind of a kid survive. It is important for those of you who are going to be delivering in a hospital outside of here. The mere fact that your child got to 37 weeks is not an indication that when the child comes out, the child is going to transit properly. Please, I beg you. Don't deliver in a hospital that does not have a blood bank. Without a blood bank, any hospital that attempts to take a delivery without a blood bank is nothing but a mortuary. I'm telling you. Obstetric hemorrhage is the leading cause of maternal death in the whole world when you put the figures together. So please, please. Secondly, don't take a delivery in any hospital that does not have the capacity of anesthesia. Per adventure, you need to transit very quickly from what looks like a normal vaginal program into a cesarean section. But more importantly, don't take a delivery in a hospital that doesn't have a pediatric team. No matter how skillful I am, during my 37 years post-graduation, to Dr. Osman's 35 years, to Dr. Konkwa's 30-something years, we cannot be better than Dr. Ulonam Charles. We cannot be better than Enrique when it comes to transiting a child from intrauterine to extrauterine life. So on the day of delivery, you are going to notice that at least 7 to 8 people will be in your delivery. You'll be wondering, what are we all doing there? I came to take delivery. Another person came to accept the baby. Another person came to make sure the baby transits well. Another person has to stand by to make sure, in case transition does not occur well, we set in motion the process. Thank you for the trust. I do hope today's class has been quite informative, and I want to thank the fathers that came. No mother has the capacity or the right to tell the mother-in-law not to do some things. Dr. Osman, I delivered a woman. Inside this hospital, I entered the room was hot. And I told the woman, you know what the mother-in-law said? You talk your own and go. We will do what we must do. And what was she intending to do? She was going to use hot water to press that child. Women, any man, any mother that tries to use hot water to press your body in order to remove blood, shout for your husband to come. Husbands, when you get there, tell your mother and your mother-in-law to remove hot water from your wife's body. The girls of these days and your mother are not the same. The girls of these days eat canned tomatoes. Your mother ate tomatoes from the farm. I hope it's been a great day. We'll see you again in 2 weeks' time.
Thank you very much, sir, for these incisive additions to all. This topic can never be completed. We will continue in our clinic, in the corridor, and we go. Please make sure you see the pediatric team at least once before you deliver. If you have not seen, as you are going now, some of you have your dates already, you have been booked for surgery, been planned for vaginal delivery or anything. Tell your obstetrician, tell them you want to see Dr. Charles or Dr. Umem, the head and deputy, or Nurse Ngozi and her team. They are available. They are in first floor in Block B. Make sure you go and see them once and have an interactive session before your baby is delivered, so that some of your expectations will be met, and we make sure that we have healthy baby, healthy mother, and a contented family. Dr. Konko is here, Dr. Barra is here, the Chendi, all of us, 4 of us are all obstetrician and gynecology. You can ask us questions. The one that we cannot do, we'll refer you to the pediatric team. Thank you for coming. We really appreciate you all for coming. MD has thanked our men already. So we're going to take the closing DIFF anthem, because our time is time spent today, but it's a very useful, time spent. We'll just take the first stanza only of DIFF anthem and the second stanza of national anthem. I please ask that we all be on our feet as we take these two anthems. God bless you all. We'll see you again in 2 weeks' time. For those of you that will be delivering within the next 2 weeks, please make sure the head nurse is waiting here and our team to give you the last extramural class before you come to deliver. Those that are delivering either by cesarean section or vaginal delivery within the next 2 weeks.
Together bringing hope for the joy of mankind, committed to excellence, home and abroad, motivated we are, together we stand. God bless this legacy. God bless this legacy.